Well, according to the CDC, pediatric hospitalizations for COVID-19 are now at their highest rate since the start of the pandemic. Those hospitalizations have started putting strain on pediatric facilities statewide. News 18's Meredith Hackler spoke with two experts about what's causing children to become more ill.
Throughout the COVID-19 pandemic, children have tended to show milder symptoms compared to adults. But now the number of cases among kids is spiking.
We've seen an increase in hospitalizations amongst the age group that's younger than 5. And the difficult part about that is they are too young to be vaccinated, so they have zero protection against the virus, so do become a little bit more sick than what we saw previously.
And while locally most kids are able to be treated in Tippecanoe County, hospitals that specialize in care for children have been seeing an increase of patients.
We have a census that is 2 or 3 times what it used to be a year ago when it comes to hospitalizations. The good news is that the majority of the children are not in the intensive care unit, although we have several, and several of the children are on ventilators.
All ages of kids are being hospitalized during this surge, but children who are the sickest have something in common.
We've seen all age groups hospitalized from infants to adolescents. However, we're seeing more of the young unvaccinated kids that are being hospitalized. Some have comorbidities and some do not. Some are otherwise healthy kids.
Dr. John Christensen says while the Omicron variant has shown to be less severe in other parts of the world, like in South Africa, that's not the case here because less people have been infected with COVID in the States.
Here, our greatest problem is unvaccinated people, okay? Unvaccinated and people who have never been infected. So most likely that's the reason why we're seeing so much severe disease among all ages here in the United States.
Which is why both say the best way to protect your kids from the virus is to get them vaccinated if they're eligible.
Fully vaccinated children have more mild symptoms, so they can still become infected and transmit the virus, but we'd see more mild symptoms such as the mild sore throat or body aches. We are seeing more hospitalizations amongst those that are unvaccinated.
We've had millions of children that have been vaccinated up to this moment. We know exactly what the safety profile is of this vaccine, and it's been shown that the vaccines are very safe. So the time for waiting has passed. Now it's time to action. Get the vaccine.
Meredith Hackler, News 18.
And due to the increase in hospitalizations, Riley Hospital for Children has had to cancel some elective surgeries. They've also been receiving help from the National Guard.